Hi, everybody. We're going to go ahead and get started. Thank you for being here today. Welcome to NAMI Smarts for Advocacy. This particular webinar is called Reimagining Crisis Response. My name is Elisa Lapolt, and I'm the Policy and Advocacy Director for NAMI Tennessee. And this is a really special opportunity today because I have with me as my colleague here for this presentation, Sita Deal, and she's my counterpart at NAMI, Wisconsin. But some of you who've been around for a long time might remember her as the former executive director of NAMI Tennessee. So she lived here in Nashville back in the day. And also with us is Eric Welch, and I knew him back in the days of when I was with NAMI Florida. So he lives in Florida, he's in Orlando. He's a consultant for NAMI Tennessee now, and he'll be looking at the comments in the chat box and helping us with logistics today. So thank you, Sita and Eric, for being here. And thank you all for being here as well. So during this workshop, we're going to discuss the new 988 helpline and the importance of improving mental health crisis response systems in our community. We will discuss how the power of your story and lived experience can help policymakers understand what you and I already know, that a person in a mental health crisis deserves a mental health response. So as part of this workshop, we're going to guide you through writing your story in 7 short steps. And you should have received an email prior to this webinar with a link to some worksheets. If you haven't accessed them yet, Eric is going to put a link to those worksheets in the chat box. And I don't know if you'll have time to print them out. We do have a little bit of time before we start our storytelling workshop, part of the workshop. But if you haven't printed them out, you can look at them and write down your answers on a sheet of paper. It's really important that you write down these elements of your story, and you'll see why. So when we get to that portion. When you complete this workshop, our goal is that you take home a version of your story that you can use to raise awareness, inspire others, and influence policymakers. This is part of our month-long advocacy series leading up to our day on the Hill on March 1st. So this is all about how we interact with lawmakers and writing your story. And at the end of this webinar, we're going to ask you to fill out a quick survey. It's going to be really helpful for us. So if you could stick around for that, we'd appreciate it. So we hope you're excited. Are you guys ready to start? All right. Excellent. Excellent. So, Eric, do we have the slideshow?
Yeah, keep talking. Give me just a second. Okay, go ahead.
That's fine. I've got to admit some more people in the waiting room. Yeah, so we'll go ahead and tell you a little bit about how this module on 988 is formatted. So it's built on what research shows that actually helps people learn. Okay, so first you'll learn what we mean when we say crisis response and what 988 is. I want to see a show of hands. Has anybody heard of 988? Okay. So next, we'll talk about why telling your story about crisis response is so important. You'll hear tips for telling your story more effectively. You'll listen to an example of a story, discover what makes a story work, and then you'll write your own story. And then finally, you'll strengthen your story with practice, sharing it. So give me a thumbs up if that sounds good to you. Okay, great. Again, today's workshop is focused on using your story to help influence policymakers to strengthen our community's mental health crisis response systems. But the tools you learn here today can be used and applied to any policy issue as you advocate for improved mental health systems and mental health care. Now, this workshop covers a lot of ground in a short amount of time. And in order for everybody to get the most out of this session, I'd like to ask you to agree on the following basic ground rules. So first, turn off or put away your electronic devices unless you absolutely need to use them. We ask that you participate fully and be willing to do each of the activities and stay focused. Please keep your video on, but keep yourself muted. I know a lot of people like to multitask with the camera off, but we're asking you to really focus and keep the camera on. Because our time is limited, please keep questions and comments brief and put them in the chat box. Again, Eric will be checking the chat box for us. To keep us on time, I'll be signaling you when we need to stop an activity. And we'll let you know by stopping the background music. And when you're writing out your story, please be willing to stop writing even if you're not finished. You can come back around at it. All right, can I get a thumbs up if everybody is willing to agree to those ground rules, the basic rules? All right. All right, Sita, I'm going to kick it to you.
Great, thanks, Elisa. So when it comes to telling a story to a policymaker, it's helpful to know what makes a story less effective and what makes a story more effective. So let's brainstorm this together. What makes a story less effective with policymakers? Put your response in the chat, or you can raise your hand. It's probably better if you put your response in the chat, and then we can read it aloud. What makes a story less effective with policymakers? It's too long, really drawn out. Yup. Too long. Right. Or if it's too emotional or too accusatory, really good. You know, too emotional, like you tear up, or too accusatory, you're accusing the lawmaker. That doesn't actually go over very well. Or if it doesn't have a clear ask, or if it has too many details and too much information or not enough information. So you really got to hit the sweet spot. That's great, everybody. So what makes a story more effective with policymakers? Concise, yup. So you just get right to the point, short and to the point. And if it's honest, I mean, speak from your heart. Be kind, but be honest. And organized. That's really important, to be organized and to practice, and also to make it personal, so that it's your story. It's not just some canned story. And then a sprinkle of emotion. Again, we hit the sweet spot so that you're going to, it comes from the heart, but it doesn't overwhelm you and it doesn't overwhelm them. That's all very good. That's excellent, everybody. Let's go on. You already know a lot about what makes a story more effective and what makes a story less effective. So just keep this in mind as we talk today.
Great, thanks, Sita. So we'd like to take a little time today to talk about why this workshop is so important. Every year, millions of mental health or suicide crisis calls are made to 911 and crisis lines, yet these responses have often been inadequate. For a long time, calling 911 has been the only option for many people in a crisis. The 911 system is designed to provide an in-person response, like sending emergency medical, fire, or police. But if someone is experiencing a mental health, substance use, or suicidal crisis, these responses frequently aren't the best option. Hospital emergency departments are often not equipped to help someone experiencing a mental health crisis. Emergency rooms rarely have psychiatric providers, and they often have long wait times. We also know that a law enforcement response to a person in crisis can have devastating results. The criminalization of mental health crises leads to people with mental illness being overrepresented in our nation's jails and prisons. A person in a mental health crisis needs a mental health response, rather than a law enforcement response that can often result in fear, trauma, and tragedy. Responding to a mental health crisis isn't the job that law enforcement officers signed up for, and it doesn't connect people to the help that they need. An alternative has been to call one of many national or local crisis lines. These are often accessed by a 10-digit phone number and have been focused on specific crisis needs like suicide prevention or children in crisis. But in a crisis, it's hard to remember such a long phone number and know which one to call. And these crisis lines are often not connected to additional local resources in the community. And some callers might need follow-up care. Additionally, crisis lines have typically been underfunded and under-resourced to meet the demand, meaning some people may face long wait times on the calls or even dropped calls. So fortunately, we have an opportunity to make it easier to access care through 988. Since July 2022, 988 is a universal number for mental health, substance use, and suicide crises. But 988 has the potential to be more than just a number. With our collective advocacy, 988 could be the first step toward a reimagined crisis system. When people call 988, they should receive the care that they need, whether it's someone to talk to, someone to respond, or somewhere to go. That transformation starts with your story. Sita? Oh, you're on mute.
Sorry about that. Let's try an exercise to show how our community's mental health crisis response has impacted people in this virtual room here. So raise your hand, your real or your virtual hand, if you or someone you know has had to go to the emergency room because mental health services weren't available. Yep, I'm seeing quite a lot of hands here. Okay, but put your hand down. Raise your hand if someone you know has had the police respond to them in a mental health crisis. Either you or someone you care about has had the police respond in a mental health crisis. Yeah, I'm seeing a lot of hands here. Okay, hands down again. Raise your hand if you've ever been afraid to call for help for yourself or a loved one because you didn't know what kind of help you would receive. Hands up, everybody, if that's true of you. You've been afraid to call. Right. And I got one more here, so put your hand down. Raise your hand if you or a loved one have tried to call a crisis line and been on hold for a long time waiting to speak to someone. Fewer hands there, that's good. And many fewer hands now that we've got 988. I don't know about you all. So hands down. Thank you all for sharing. Your responses highlight what we all know well. Somebody experiencing a mental health crisis deserves a mental health response, but our current system falls short. Elisa.
Okay. Thank you, Sita. So just for some background, Tennessee has historically had a statewide crisis line. It's 1-855 Crisis 1 that connects Tennesseans to services in their community. But for many years, there's been no national crisis line to do the same. We also have the Tennessee Red Line for people with gambling, alcohol or substance abuse, addiction issues for referrals. There's also been a national suicide prevention lifeline with a network in Tennessee for callers in crisis. And people could call crisis lines at community mental health centers. But thanks to mental health advocates across the country, Congress took an important step forward for crisis response by designating 988 as the nationwide 3-digit number to reach the existing National Suicide Prevention Lifeline Network, and expanding the scope of the Lifeline to include support for all mental health and suicidal crises. So this is a huge step. It makes it easier to reach a crisis counselor for any type of mental health emergency from anywhere in the United States. And it happened because advocates like you told Congress that people living with a mental illness in mental health conditions, and their families needed a better option during an emergency.
Excuse me, Elisa, I think there's a black box on the slide. Eric, I don't know if you
Oh,
can do
Eric, can you minimize that box there?
And then there's another one up above.
Yeah, I think it's because we're seeing Eric's screen. Yeah, if we can minimize that. So I'll go into a little bit more of the history. There we go. Thank you. Thank you. So in July 2022, the renamed 988 Suicide and Crisis Lifeline became available nationwide. Like calling 911 during a physical health emergency, you are now able to call or text 988 for a mental health, suicide prevention, or substance use crisis, 24 hours a day, 7 days a week. But unlike 911, which dispatches emergency services, contacts to 988 are answered by trained crisis counselors. For most who call, text, or chat in the 988 Lifeline, the counselor will be able to de-escalate an immediate crisis without the need for an in-person response. So this is a really great, amazing first step, but your continued advocacy toward reimagining our, not only our national response, but our response here in Tennessee. We need stories for people, from advocates, and those stories are more important now than ever. So on the next slide, we're going to walk you through what happens in a 988 contact when somebody contacts 988. The 988 Suicide and Crisis Lifeline Network is made up of over 200 local call centers, including 7 here in Tennessee. There are 3 centers in our state that handle chat and text. So for this example, we'll focus on specifically on phone calls to 988, even though chat and text are still available. Calls made to 988 are first routed to those local call centers, but ideally call centers are answered locally. But if a local call center doesn't have the capacity to answer at that moment, maybe they're understaffed or a lot of calls coming in, the calls are then rerouted to a national backup center. And there's backup centers. In either case, a trained crisis counselor answers the call. And you can see this visualized on the slide. I do want to mention there is a little bit of a kink that's being worked out now with this. So if you're calling 988 from within a state, but your phone has an area code, your phone number is from another state, there's a bit of a challenge here. So if you have a Chicago phone number, for instance, and you're calling 988 in Tennessee, they're going to route you to a Chicago call center. So this is the challenge of what's called geolocation, and it's being addressed by NAMI advocates and many others, including the FCC. And it's going to take a while to iron this out, but just know that this is something to be aware of. Even so, everyone who calls, texts, or chats the 988 Lifeline, they're going to reach a crisis counselor. But here's the thing. Not everyone will have access to sufficient local resources that ensures a mental health response is provided to those in a mental health crisis. And so let's think about this for a minute. You call 988, you talk to a counselor, ideally you get referred, but are the services available in your community? Once a person is stable after a mental health crisis, they may have to wait weeks to get follow-up care from counselors who have waiting lists. Maybe there are no mental health professionals in your area. The full crisis response system may or may not be available in your community. So this is why your story can help policymakers understand what services are still needed in our communities after people call 988. So, Sita?
So now let's take some time to talk about what we mean when we say a crisis response system. So in the chat, or raise your hand, what do you think would help someone who's experiencing a mental health crisis? What do you need when you're in a mental health crisis? And what helped you or a loved one? Someone to talk to, right? Someone who's not judgmental. Compassion, right? Exactly. Patience, yes, absolutely. Because you may be having trouble expressing yourself. That's good. Maybe somebody who could come to your house and de-escalate. And what's something that you wish had been available to you or the person that you care about who may have had called crisis? Somebody who understood trauma, right? Someone with experience with mental illness, someone who really listens. Yeah. Those are all excellent responses. So I'm going to turn it over again to Elisa.
Great. So this is where we're going to dig in and learn a little bit more about the three components of a strong crisis response system. And we are so lucky here in Tennessee because before 988 even came into being, we had these components in our state. So we'll start with the first one. The first component is a 24/7 local crisis call center. When someone dials 988, their call should be answered, no matter when they call, by staff who are well-trained and experienced in responding to a wide range of mental health, substance use, and suicidal crises in a culturally competent manner. Yes, somebody just wrote culturally sensitive. Thank you. Thank you for doing that. Right, saying that, Dawn. When a call cannot be answered locally, like we said earlier, it goes to a national call center. While national call centers still provide important support over the phone, they cannot easily connect a caller to local resources here in Tennessee to help them get and stay well in the long term. So that's why we need local call centers fully resourced and trained to help the caller access resources in our communities. So here's some interesting information. Our State Department of Mental Health and Substance Abuse Services just received $1 million in federal funding to expand 988 capacity. You know, it was being rolled out across the state, but then they got extra money to expand capacity in Knoxville, Nashville, and West Tennessee. So it's important that these 988 dispatchers can connect people to services in those communities, like scheduling appointments with local providers, conducting follow-up calls, and dispatching mobile crisis teams for people who need an in-person response. It's also important that benchmarks are created to track progress on how well our 988 system is working. Are people getting referred to services? Are they getting those services? The State Department of Mental Health and Substance Abuse Services just got a federal grant to collect that information. It's for data collection. And we've been talking with them about how they collect the information. Good reporting on our 988 system and the community services, it's critical to determining crisis response in Tennessee. Sita?
So that brings us to the second component of a strong crisis response system, which is mobile crisis teams. Sometimes someone in a crisis will need more support that can be offered via the phone or text or chat. And in those cases, mobile crisis teams should be the primary response dispatched, not law enforcement. These teams should be staffed by mental health care professionals like social workers and nurses and emergency medical technicians and peer support specialists. Mobile crisis teams can often de-escalate and resolve crisis situations on the scene. When needed, they can connect the person in crisis with additional services and supports. So in 2022, there were 70,000 mobile crisis unit visits conducted in Tennessee. That's a lot, according to state data. The teams are run by a network of providers. So you can click on the map that's in the chat to see who they are and where they're located. Strong collaboration between 988 and 911 systems is critical. Law enforcement should only be included in the response when absolutely necessary. So 988 operators and law enforcement officers should also be able to quickly hand off to the 988 crisis system whenever appropriate. So law enforcement should only be involved when safety is an issue, when preserving safety is an issue. Otherwise, there should be mental health and substance use personnel. So our continued advocacy is needed to increase the availability of mobile crisis teams and minimize the involvement of law enforcement in our community's response to mental health crises. Next slide, Eric. And finally, I don't know. If someone needs, I think you're going to have to back up to where you see the hospital. Yeah, there we go. Finally, if someone needs more intensive care, there needs to be an alternative to going to the emergency room. Our emergency rooms, as all of you know, or many of you know, are overcrowded and there's long wait times, and they often don't have psychiatric providers at all. So for those who need more care, the third component of an ideal crisis response system is crisis stabilization units. Crisis stabilization should be provided in a warm and welcoming living room-like setting, offering short-term observation and stabilization services, which may be for less than 24 hours. That may be all people need in order to avoid going to the hospital or bad things happening. It's important to note that crisis stabilization is different than a psychiatric hospital. Crisis stabilization options include walk-in psychiatric urgent care, which we have several of in Tennessee, and peer-run respite programs. Crisis stabilization options often also serve as drop-off locations for law enforcement to reduce unnecessary arrests when they're called to respond to a person in crisis. And we've had these in Tennessee since the late 80s, so we're well ahead of the curve. But we have them across the state. I was here in 2007, 2006, 2007 when we stood them up across the state. So we're well ahead of the national curve here. In Tennessee, there are 8 crisis walk-in centers and crisis stabilization units managed by community mental health centers. And again, you can click on the map in the chat box to see them. These programs would then provide a warm handoff to follow-up care, including peer supports and outpatient services, or in a small number of instances to more intensive care, such as hospitalization. But if people get the crisis care up front, they are far less likely to need intensive hospitalization. And that's what we're shooting for in the crisis response system. Elisa, next slide.
Yeah, thanks, Sita. So these 3 key components ensure that a person experiencing a mental health, suicidal, or substance use crisis has someone to talk to, someone to respond, and somewhere to go. Where this system exists and where there's strong law enforcement partnership and collaboration, this model is successful. According to the State Department of Mental Health and Substance Abuse Services, the majority of contacts to crisis lines can be resolved over the phone. So having the capacity to answer all contacts quickly is critical. So, for instance, what we learned from the State Department is that when they looked at the last 6 months of 2022, 42% of the callers to 988, they just wanted somebody to talk to. And another 30% were non-emergency mental health referrals. So 72%, they just wanted help and they just wanted somebody to listen to them. So of those calls, only 3% of calls to 988 in Tennessee have resulted in law enforcement involvement. And 4% of those calls involved mobile crisis. Those figures are based again on the second half of 2022. So we're going to stop for a minute, and then I want to ask you guys a question. So what strikes you about this model? What strikes you as the system we set up? Mobile crisis, crisis stabilization, call centers. What do you find valuable or interesting about it?
I could have missed how long have we had these options in East Tennessee, or in Tennessee in general? Sorry.
Since 2007.
Okay.
So I was around, I was with NAMI Tennessee at the point when we set these up. And we
Okay.
said at that point we had 7, now we have 8. And we had a statewide crisis line, and that was well ahead of the curve at that time.
Mm-hmm.
So we've had much of this in place, although not enough.
Mhm.
I asked this from my personal situation and personal lived experience. I had mental health scares, crises in 2014, 15. And I was good for 5 years. But in that 5-year session, I was passed off from, a psychiatrist or whatever. I don't recall getting this like data, like, hey, this is a number that you need to have on your refrigerator kind of situation. So you asked what sparks interest or what comes to mind. For me personally, kind of selfish, but that's what came to my mind. Like, hey, I don't think I was aware. Yeah, that's it.
That's why 988 is so helpful, because when you're in a psychiatric crisis, you can't, it's hard to remember my name, So being able to dial 988 rather than trying to find that number wherever I put it, or, look for it on the web, it's an unrealistic expectation. So just dialing 988 in a mental health or substance use or suicide crisis, that's what we needed.
Yeah. Would have saved some money. I had to go to ER in 2020, but yeah.
Wow. Well, it sounds like you'll be able to share that story a little bit later when we get to the storytelling piece. Be excited to hear about that. So Marta says it's what she likes about this model: safe place for me to talk about what's going on and be assessed if I have a real crisis. Yeah, that's good.
Alisa?
Yes.
I'm sorry, I can't type. I know that one thing that it shows you that we had a lot of unnecessary calls going to 911, and it's taken a big relief off of 911 with us having 988.
Yes, definitely. That is true, and I think the state figures are starting to show that.
And the other thing about 911 is that their general protocol is to call the police rather than mental health providers. So 988, the general protocol is to call mental health providers and only to have police as backup as needed.
Mm-hmm.
So it decriminalizes the crisis situation.
And what about the notion of having somebody connect you to resources and maybe even set up appointments? And that sounds pretty exciting, that whole possibility. So Sue says the focus these offer is important. The trained personnel can focus on the mental status and not on a possible crime situation. Bingo. That's it. Yeah. Okay.
And Marta says, a safe place for me to talk about what's going on and be assessed if I have a real crisis.
Mm-hmm. Excellent. All right, Sita, you want to pick it back up?
Okie dokie. So let's go on to, is it? Yes. So we've still got these lovely black boxes. Poor Eric, he's trying to get rid of the black boxes. So we'll just be patient. To create a comprehensive crisis response system like the one we just described, it's going to take time. Even though we have much of this in Tennessee, building it out so that it's available in every community is going to take time. It will involve data collection and reporting from the state level just to see where we are doing it and where we aren't doing it, and when we are doing it and when we aren't doing it. And on the ground level, it's important that we as advocates pay close attention to whether or not services are available in our county. So whether services are available in Robertson County versus Davidson County, that's a big question, or Obion County versus Shelby County. So we have mobile crisis teams, but are there enough? Are we diverting people from jails and into mental health care? We have crisis stabilization options and walk-in centers. Do we need more? How long do you have to wait to see a therapist in your community? How long do you have to wait in a hospital emergency room to be seen by a mental health professional? So this is where your advocacy is critically important. Your story can help policymakers understand where the current system is falling short and where they can do better. So we're at the beginning of this journey of reimagining what crisis services look like in Tennessee under the 988 system. And we need our lawmakers to learn about 988 because many of them don't know about it, or they certainly don't know enough. So that part of the education involves telling your story. So in a moment, we're going to take you through the steps of writing your story with some time to write at each step, that step of your own story. And then you're going to be able to practice it with each other. And for now, we're just going to spend a few more minutes talking about our goal. Elisa?
Great. So sometimes policy change takes time, and there are a lot of ways that we can measure progress. For example, national benchmarks require states to keep records on how these calls are working. The national benchmark, for instance, is for 90% of calls to be answered in state, and Tennessee is meeting that goal. Another standard is for call response to be within 30 seconds, and in Tennessee, it's 22 seconds. In the last 6 months of 2022, there were 21,000 Tennessee calls to 988, and that is 500 a month more than the calls to the National Suicide Prevention Lifeline from Tennessee. And on top of that, if that weren't enough, there were another 10,000 calls and texts to 988 from people in Tennessee. So we need time to see how this is working. And over time, we'd like to see a full evaluation of how 988 is working and whether people are getting the follow-up care they've been referred to in their community. That is our goal. And we need lawmakers to become familiar with 988 and what it offers. So this is where your story is especially important. So the Tennessee General Assembly is about a month into their four-month session, and they're faced with competing priorities all the time. They're not just responsible for healthcare. They must also make decisions about transportation, education, housing, and more. So as advocates, we can share how important it is to strengthen and sustain a mental health crisis response system. And your story is a way to speak up. It helps illustrate what happens and what helps. Your story will help policymakers realize that we can continue building the crisis response system here in Tennessee under 988. And by telling your story in a compelling way, you can help change attitudes and influence policymakers. So now that we've gone through the background of 988, I'm going to ask Sita to share a sample story. So this is a story from the perspective of a peer. So we emailed you some worksheets, or you can also, I'm going to put a link to these worksheets and you can bring them up in the chat. And they also include a sample story from a family member. So there's some other examples of what a storytelling exercise looks like, what a story looks like. And your own story and perspective is unique, and you may or may not relate to these sample stories. The story is told in a way that as if the person were in a legislative committee meeting and giving testimony before a group of lawmakers. This is a basic 7-step format or recipe that can be easily adapted to fit other situations. So when Sita reads this example, I'd like you to keep an open mind and notice your reactions and what moves you or has impact for you. So Sita?
Hello, I'm Jessica Smith from Monroe. I'm a member of NAMI Monroe, part of America's largest grassroots mental health organization, the National Alliance on Mental Illness. I'm here today to tell you about my experience calling the 988 Lifeline and to urge you to invest in our crisis call centers. My periods of depression can be quite severe. During these periods, I can hardly get out of bed some days. One night, after finding the energy to make dinner, somehow, I was all consumed by a wave of hopelessness. I felt overwhelmed, and I did not see how I could wake up the next morning and go to work. I wasn't even sure I'd make it through the night. I knew I needed someone to help me. I called 988 and was connected to my local crisis call center. The person on the other end of the phone talked through what I was feeling, and she helped me make a plan of what I would do next that didn't overwhelm me. And she gave me resources on a local support group I could connect to. The counselor was also able to schedule an appointment for me with a mental health professional later that week. Once I got off the phone with her, I was able to go to bed and get some sleep. I woke up the next morning feeling something I hadn't in weeks: hope. Eventually, I was diagnosed with bipolar disorder and have been receiving treatment ever since. I still get periods of depression, but I better understand the warning signs and have a provider I could reach out to when things feel overwhelming. Because I was connected to a local crisis call center, the counselor on the phone knew of resources in my area and was able to schedule that follow-up appointment. Counselors are able to help de-escalate a crisis situation, but how do we know if they're connecting people in other communities to the follow-up care they need? Are those services even available? It can take weeks to get an appointment with a counselor. Thankfully, calling 988 helped with my immediate crisis, but I wouldn't have known where to look or how to find the follow-up care I needed. I know others may feel the same, and I want everyone who experiences a mental health crisis to access services in their community. People need to know that this 3-digit number is available to them if they're having a mental health crisis, and they need to be connected to follow-up care that's available in their communities. I ask that you learn more about 988, how it's connecting people to the needed care in their area, and whether they're receiving that follow-up care. Thank you for listening to my story. Can I count on you to learn more about 988 and the crisis service continuum?
So as you listen to the story that Sita just read, what language moved you? Were there specific words or phrases? And you can type it in the chat box. Lori says hope.
Sue says overwhelmed. I was overwhelmed. That's true. And even common everyday activities were hard for me.
Appointment made, excellent, yeah. That's what Sue says.
And it's really important, as Mary says, to have the ask. And I made I statements. I talked about how I felt. And that the counselor gave me hope.
Easy to understand, and information moves for action. Yeah, that goes back to the ask. Oh, Sue brings up a good point. I like this. She wanted that hope for others. I like that too, because she wanted to use her story to help other people. Great. So you can see how storytelling can be compelling. Okay. And now you can do the same. So we're going to ask you to take out your 7 steps checklist. Okay. So hopefully you've printed it out. If not, I did put in the chat box a link to where it is on our NAMI Tennessee website. I'm going to just give you a couple minutes. And if you haven't printed it out, you can bring it up on your screen and you can write your answers on a piece of paper. So if you need to run and get a pen and a piece of paper, we can do that. We'll just take a couple minutes to get settled in. There's also a story practice sheet. All right. Does everybody have your worksheets or your paper? Okay. Okay. So let's dig into the 7 steps. So we're going to walk through the checklist step by step. Eric, can you go back to the previous slide? Yeah, thank you. We're going to see how it applies to the story you've just heard. And you'll have a few minutes at each step to write your part of your story. If you don't finish a step before we move on, it's okay. You can fine tune it in your own time. It's also easier to write bullet points than full sentences. So just get some ideas down. You will be writing a basic story that you can use if you meet with a policymaker, write to them, or make a phone call. You can use the same story to email them. As we go through the process, put any questions in the chat box. Remember, the best preparation for telling an effective story is to know your ask. So in the chat, in the story that Sita just read, what was the ask from the sample story? Support 988. Will you learn about 988? That's it. Learn about 988 and crisis services. Exactly. Right. If you have experience with crisis services and you feel okay to talk about it, focus on crisis care in your story. If you'd rather emphasize another issue, you can do that too. So now I'm going to walk you through, or Sita and I are going to walk you through step by step, giving you a couple minutes for each step. If you have questions, again, just put them in the chat. So we're going to start with step 1, the introduction, and it has 3 parts. This is the easy part. First, give your name and city or town. And in the chat box, why is it important to tell the policymaker where you live? Right, Jarvis says it makes it personal. So they know who represents you. Yeah. Excellent. To appeal, yeah, you're a constituent. Not only are you a constituent, you're a voter. And they like appealing to voters. You always want to say, hi, I live in your district. And you know, I've been a lobbyist for more than 20 years, and whenever I would make an appointment with a legislator, if somebody from his or her district came in for an appointment, I would always get bumped. The professional lobbyists always get bumped, and they will meet with the constituent first. A lobbyist or an expert can be in the meeting with you if you want to provide information, but remember that legislators work for the people who live in their district, and they will welcome you. Usually what happens is the aide will squeeze you in somewhere because you're a constituent. So in this first step, you want to include your organization. You can describe yourself as a member of NAMI Tennessee. the state chapter of the National Alliance on Mental Illness, or if you work at a treatment center, mental health facility, say that. Or if you're just there for yourself, you can say that too. And here, this is important. Tell how you are connected to mental illness, whether personally, as a family member or friend, or in your work. Many people wear multiple hats. Like, I've had anxiety, and I grew up in a family of people with mental health challenges. And finally, state your position in the issue. Tell the legislator what you want them to support or oppose. This helps them focus. So today, what we want is for legislators to learn about 988 and ask constituents whether they're getting the follow-up services they need in their community. Okay. So
Jarvis is asking a very important question. He's saying, if I have lived experience, won't the stigma of it hurt my story? And actually, no, it gives you credibility.
Okay, I'm going to let you in on a little secret, Jarvis. When I've talked with legislators about mental health policies and issues, they will share behind closed doors. My grandmother was bipolar. My father died by suicide. Some of them will talk behind closed doors. And what we're starting to see now is they're speaking openly about them. There was a committee meeting I was attending last year where I think it was the House caucus leader, so very high up, high-ranking Republican, said in committee how important it was to fund mental illness because mental health services because his own father had died by suicide. It was the first time he'd ever said that publicly, and his own colleagues didn't even know. And it was so powerful. So never underestimate the power of your story. Great question, Jarvis. Thank you. So what we're going to do, Eric, we're still in activity 1. So if we can go back a slide, that'd be great. What we're going to do is we're going to take about 4 minutes.
And I don't know if we have all 4 minutes. Maybe people have been writing.
Oh, yeah.
Maybe just take a couple, like 2 minutes.
Yeah. Okay. Yeah. And so we'll do the personal introduction, name, organization, city, relationship to mental illness, and what you want them to do. And then we're going to play some music in the background. Eric, if you just play music for like a couple minutes, and then we'll come back on. Okay, Sita, do you want to go on to step number 2?
Okay, so let's go on to step number 2. What happened before you received the help you need, or the person that you care about, before they receive the help they need? Keep this brief and just a few bullet points and paint the picture. So it's short, but it's vivid. It's like one of those, splash of paint style pictures. Think about the most important thing you want your listener to know. So if you can get it down to like 3 bullet points, 3 things you want your legislator to know about what it was like before you got the help you needed. And if you were in crisis, paint that picture like she did. Like, I didn't know if I would be able to wake up in the morning. So we're going to take 4 minutes of music, and we'll stop it at 3 minutes, just to tell you got 1 minute left. One minute left, folks.
Great. Again, if you didn't finish, you can come back to it and just write bullet points. That makes it quicker. So for step 3, you're going to describe what happened with recovery or what would have helped. This adds a hopeful tone and shows the value of supports and services. If crisis services have helped you or someone you care about, say what happened, and this will strengthen the ask. Okay, so again, we're going to go into writing mode. We'll play some more piano music, and we'll let you know when it's time to wrap up. Okay, we'll need to wrap it up here shortly. Okay, so we'll go on to step 4. Sita?
So in step 4, share what's going right in your life or the life of the person that you care about and how you're experiencing recovery. This concludes your personal story on a positive note that inspires. People often think that you have to evoke pity in a legislator, but if you think about it, they're investing taxpayer dollars. So they want to invest in what works. So if there's some way that you can end your story on a positive note, what's going right in your life? And if you had crisis services, how the crisis was resolved or would have been resolved. If your story didn't have a positive ending, what would have helped? So let's take 4 minutes to write this part. Is it 4 minutes?
Building your online business? Go to Wix.com and set up your store on a single integration.
I'll just take a few seconds to wrap it up, and we're going to move on to the next part of the story, and where you're going to pivot from your personal experience to the broader need. So steps 5, 6, and 7 can be very similar to Jessica's story. We're just going to paste her phrasing into the chat, or you can simply copy it and put it in your own words.
Yes, so I just put in the chat what the problem is. And so for activity 5, what is the need? The need that I put in the chat is people need to know that 988 exists when they're in a mental health crisis. And we need to know that services are available to them when they call 988. So we'll just give you a couple seconds to jot that down on your storyline. Eric, we don't need music for this one. We're okay. We're bringing it in for a landing. Okay, Sita, we'll do activity 6.
Okay. So now talk about what will help. For example, tell the legislators, we need you to become familiar with 988, and we need you to learn what the crisis system is doing to link people to services. We need public, transparent reporting to know where the gaps and best practices are, so we can keep people from falling through the gaps. So we're just going to take a couple minutes here. And you can write exactly what's on the screen, or you can just put it in your own words, or you can just jot a couple bullets. So just a couple minutes.
Okay, we'll go on to step 7. And this is where you make your ask. So thank you for meeting with me and listening to my story. The ask is, can I count on you to learn about 988 and support efforts to fully evaluate whether Tennesseans are getting the mental health care they're being referred to? And I'll type that into the chat box. So just to let you know, there's no legislation this year dealing with this. We're laying the groundwork this year. We're educating them about 988 and telling them why it's important to keep monitoring this. Okay. So if you were to be in a meeting with a legislator, if they say yes, you thank them for their support. And if they no, or they kind of give a vague answer, just thank them for their time and offer NAMI as a resource for mental health. So I'll give you a couple minutes just to chat this into your story or type this into your story. I'm going to put it in the chat real quick. Can I count on you to? Okay, so there it is. Okay. So, thanks everyone. If you didn't finish writing your story, that's okay. You can fine tune it and finish it in your own time. So we're going to just take a couple minutes to, I want to find out what you learned from this process in writing your story. You want to put it in the chat? Or if you want to raise your hand, we can talk a couple minutes about it. How to shorten my story. Yes. Jarvis says how to break it down so it's not overwhelming. Yeah. Organization. Yeah. It's tough when you've lived it. Like, how do you get all this information up here down into 3 sentences? Yeah.
making specific points, right?
Yeah.
How to be quick and specific and yet cover the waterfront. That's the challenge.
Are the legislators that tough? Is that something, oops, let me see, is that something I learned? Are the legislators that tough, meaning they don't want to hear your story?
Well, I guess they're a busy bunch. I totally understand that. But kiddingly, it's like, do we need to really fine tune and focus our story so that they can listen? They are approached with so many different items, I'm sure. So kiddingly, yeah, I probably do have to learn to shorten my story.
Right.
Yeah.
I always tell people you don't need to list out all 13 medications you tried for bipolar disorder. Just say, I've tried a lot of medications, you know, it's okay. The point is still there. So.
And they're very busy. So a quick, vibrant story is what will stick in their heads. If you tell a lengthy story, they'll start looking at their watch.
Definitely.
So
Okay.
let's go on to sharing, practicing and sharing. So you've all finished, or you have a good start on your story. It won't be a finished product right now. You've just kind of thrown it down. But we're going to practice sharing them in breakout groups of 2 and giving constructive feedback. So take out your story practice sheet, and then you have constructive feedback forms that have a little scale on them. I'm going to see if I can hold one up. Although it's hard for my camera to get a hold of it. But you'll see that they follow the line of the 7 steps, and then they have a scale from it would benefit from strengthening to very strong. So this is constructive feedback. Constructive feedback is to help you make your story even stronger. It acknowledges that it's good and it's powerful, but it will make it even stronger. So each of you are going to have a chance to share your story in a group of 2. One of you will be the storyteller, and you're going to tell your story in 2 minutes. The other person is going to time you with their cell phone or whatever and stop you at 2 minutes so you can feel what 2 minutes feels like. Sometimes it feels like a long time, and sometimes it feels like a very short time. And then you're going to take just a minute or 2 to give feedback. So the person who's the listener and the timer is going to take a minute or 2 to give feedback about what was really great about the story and what would make it even better. So after the storyteller's 2 minutes are up, and then you give them feedback, then you're going to switch, and the first person be the storyteller. And we will give you a 4-minute warning when you should be switching over. So I am going to send you into breakout groups, hopefully. And I think, oh, there's one here. I'm going to have to move somebody into a breakout group. There. All right. So I'm going to open all rooms, and you're either going to have 2 or 3 people in there. And you'll have 4 minutes for each turn. 2 minutes for a story and 2 minutes for feedback. And press the little join button.
Welcome back, everybody. Okay. So how was it? I want to hear some comments. Was it scary? Was it?
Yes, it was nerve-wracking.
Really?
Yeah, I was like, you feel a little under the gun to get, I guess, because this is an emotional topic. Mental illness is emotional. It is. It's you've gone through the ringer. So yeah, having to, break it down, make it short. What sometimes you just want to, and you really can't do that. I totally get that. So yeah, a little nerves. You want to make sure you're doing it right.
She did a great job. She couldn't tell there was nerves. The only thing she went over just a tad, but it was okay because everything she said was pertinent, and it was so important and impactful.
That's really valuable. So you feel nervous inside, but your listener goes, wow, this is great.
Thank you.
I got a great experience with listening to Jarvis and I was nervous too. This is the first time I'm doing this, so but I was able to keep it on 2 minutes. Are we really gonna have 2 minutes only to talk to the senators? It's gonna be nerve-wracking because I'm gonna have to condense or use other words that are gonna. It was very overwhelming for me.
Well, it's
You did
best.
great,
It's like
though.
a movie trailer. You know, if you give them 2 minutes and then they ask you more questions, then you're in the catbird seat. So you know, short and punchy. But Jarvis, go ahead.
Oh, and I was just trying to encourage Marta and let her know that she did great for the first time. She's going to be fine.
Awesome. So thank you so much for sharing your stories. And what was effective for you? Like what really stuck out for you? Like when you heard the other person's story, what jumped out at you?
How similar the recovery stories are, even though they're different, for everybody kind of experience the same. That's what I have.
Excellent.
Yeah, I agree. Compassion. We're all in this together. We all have a story, and it's nice to gather and support each other.
It's great.
And a reminder, as Elisa said, if you get extra time, you'll hear others share their stories, lawmakers. And I think you and I both have just, again, eyes wide open when we're in the middle of a meeting and suddenly they're like, oh yeah, you know, my brother's battled schizophrenia for all his life. I totally get this. And you're like, oh, well, good. Support this then.
Yeah.
Sometimes it can be the smallest thing too, because I think about when I used to be with NAMI Ohio, and having a family member, a father, stand up there and talk about his son in such a personal way. I think about the way Jarvis talked about, you know, his intention was to walk across the stage and graduate with his class, and he got disrupted. And that's the stuff that stays with you. And those little moments, because I remember we had this father up there testifying, we had lawmakers who didn't have tissues. They were all grabbing papers and trying to wipe their eyes. And you never know what's that one little nugget that's just going to grab hold and be so personal for someone else and so relatable. And I think about, because Marta did the same thing. She talked about what it meant to her daily life and how it took her off a path she had chosen. And that's the thing that makes people go, oh, then it's so relatable. And that's it. That little 2 minutes, whew, it all of a sudden becomes this big conversation, and it's amazing.
And another tip, the more you say it out loud, whether you say it to your mirror or your dog or your long-suffering spouse or whoever you say it to, the easier it gets. You know, so you just say it out loud. And then you feel less nervous, and you're more sure of yourself.
And one more important thing on why you share your conversation and share your story is your story may also not only be your own conversation, but I mean, Elisa was, I think, in the room when this happened, but lawmakers then started sharing their own story to the entire chamber of like, we need this passed. You know, you're nodding your head. I can't remember which one that was, but you remember that. Like, you talk about everybody, like the fellow lawmakers are crying over the story, and you put that seed in to say, it's okay to break the stigma and stand up in front of your peers, other lawmakers, and say, you know, this happened to me too. And who was that, at least? Do you know what I'm talking about? You know what I'm talking about.
It was Representative Stevens. She had a bill.
Oh,
about
yeah.
First
That was,
episode psychosis.
yeah,
in
that was
Florida.
huge.
Yeah. So
I had the same experience with a mental health awareness day that I had in my hometown, and I invited the mayor. And there's nobody here that is from my hometown, so you don't know him, but he shared a very personal story, and in front of the crowd, it just brought it out of him. He said he felt comfortable to share that. So, you know.
yeah. So, well, Sita, do you want to go on to the next slide? And thank you for sharing all that. Your feedback's really important. And so, at least we talked a bit about what you learned. So yes, earlier in the webinar, we discussed how using a skill in real life is the best way to learn it. And so you can take these stories and there will be chances to advocate. March 1st is our day on the Hill. And if you want to come meet with your legislators, I can help set up the meetings for you. I can help you fine tune your stories. And we'll have lunch at the Capitol. And you can share your story and tell them about the need for a full 988 crisis care continuum. And I will put in the chat box here in a second the link to signing up for that. You can also join us next week if you want to get into some of the policy issues and hear what bills that we're working on. There's some good stuff that's been filed and not so good stuff. So we'll talk about that more later. And then we are going to continue working on our stories on February 22nd. So if you want to join us then, you can fine tune your stories. And some people will be hearing this for the first time, but you'll already be an expert on it. Let's see. I'm going to also ask you if you could fill out that survey. I just put a link in the chat box. That would be super helpful. And then here is my email. If you have any questions, if you want to meet with your legislators, just let me know.
I'm not seeing the link to the poll yet.
The jot form where it says,
I'm not seeing that link in the chat. Are other people seeing it?
it says HTTPS jot form. Okay, let me try this again.
You have to scroll up. It's way before.
Oh, okay.
Just scroll up.
Oh, okay. Yeah. So telling your story, everybody, is part of NAMI Smarts for Advocacy, which is NAMI's signature advocacy skill building program. So if you would like to have that in your area or in your affiliate, we help people learn to tell their story, learn to make an impact with phone calls and emails and social media, how to make really good use of 5 minutes with your legislator in person. You meet them in the Piggly Wiggly in the parking lot. What do? You know, that sort of thing. And then also we have special modules on the budget and parity and various other things, including crisis response. You've just done the crisis response module. So if you want more, contact Elisa and she may be able to set it up in your community.
I just thought of one more thing too, that Elisa puts out advocacy alerts at some point. So it may mean like this little story thing could just be a voicemail on an advocacy alert, which is, hi, my name is Jarvis. I'm from blank Tennessee, and I live with bipolar disorder, and I want you to support XYZ. It's 30 seconds of that, but Elisa occasionally will put those out to everybody. Fill out this email, send this phone call, and believe it or not, it is super important. When those voicemails make a difference.
And if you've got your story written up like on the computer, you can just copy and paste a bit from your story into the email and makes it really quick.
And then I just put in the chat box the link to sign up for our other events. You go to one page and you'll see the remaining 3 events you can sign up for. Let's see. I will do my email address again. All right. Do you all have any questions for me?
No, I just want to encourage everyone when you're going to speak to your legislators. This will be my 3rd year representing my son. I know you're nervous probably, as you all stated earlier, but once you get in and tell your story, as everyone else has stated, every time I've told my story, one of the legislators shared with me one of their family members.
Mm-hmm.
So just go in knowing that you are trying to make a difference for yourself, have that mindset, and go in knowing that you are trying to make a difference for your loved ones and everyone that is suffering with mental illness. And if you go in with that mindset, I promise you're going to rock it and you're going to do great.
That's awesome. Will you come share that story on the 22nd when we do our storytelling, the next part of this?
Absolutely. I already I'm off from work already. I took off for it.
Oh my gosh, that's awesome. Thank you. All right.
What if we cannot make one of the classes, of one of the meetings?
Well, we're recording them, and you can watch them later.
Okay.
Yeah. Okay, did everybody fill out the evaluation? That would, yeah, that's gonna be super helpful for us to fine tune this. Well, thank you so much. This is, this is my favorite time of year of the legislative session, and teaching people how to talk with their legislators. It's easier than you think, and it's so important because you do have stories and you can make a difference. So thank you so much, and have a great evening. Thank you for being here.